first question I would ask Benner is, what role does continuing education have in advancing from one stage to the next? Benner's theory focuses on the impact of learning from clinical experience. While she does not dismiss the importance of theory-guided practice, there is little emphasis on how continuing education impacts progression through the levels. Benner states, expertise takes time to develop, and it is neither cost-effective nor practical to try and teach it in formal education programs. It would be interesting to expand on the impact of graduate level preparation on Benner stages, as more junior nurses are pursuing master's degrees than in the past. Nurses are encouraged from an organizational, regulatory, and professional practice standpoint to participate and engage in self-directed learning. As nurses progress through the stages, they are increasingly capable of making connections between educational information and practice. Technology has changed how we learn, and simulation has become a more experiential learning opportunity than instruction alone. What strategies would Benner propose to recruit and retain nurses? Today's healthcare environment is fast-paced and technologically driven. Patient acuity is high, and nursing care has become increasingly specialized. Hospitals are struggling financially due to a lack of funding, and nursing positions are often not filled, which contributes to burnout and increased staff turnover rates. Benner notes few incentives or rewards for long-term careers in hospital nursing have been offered. She cites advances in pay, status, and quality of work life as reasons nurses have left the profession or pursued administrative, teaching, or community health positions over direct patient care in hospitals. She suggests organizational support such as clinical specialization opportunities, staffing stability, and discretionary decision-making for expert nurses as potential career incentives. While these are good strategies, they lack depth in terms of how this can be achieved. What is the best orientation model for nursing? Benner states, new nurses are usually at the advanced beginner levels in most clinical areas, so clinical experts are needed on the patient care unit to provide on-the-spot clinical teaching. With lower staffing levels and nurses leaving the profession, the number of expert nurses may be decreased. What does the competent or proficient nurse have to offer for new hires? These groups of nurses know the perspective and challenges of the new nurse and can offer a level of understanding and emotional support that maybe a nurse working for 20 years could not. The impact of socialization in nursing is worth exploring, as novice nurses and advanced beginners need to feel supported and valued in order to grow professionally. Benner's theory is helpful to understand the experience of an expert nurse moving into a new specialty area. I currently work in perioperative nursing, which requires a formalized postgraduate education program and on-the-job training. Many of the nurses who come to the operating room are not novice nurses. Some have been practicing for many years and would be considered experts in their prior work environments. When these nurses join the perioperative team, they often feel uncomfortable as they no longer intuitively know what to do. They are also impatient in that they want to learn everything right away without giving themselves time to progress. Benner's research suggests the ability to perform as an expert is grounded in the context the nurse is experienced in. Nurses regress to a lower level of clinical competency upon beginning work in a new subspecialty or unit. Nurses who once relied on intuition will revert to seeking out propositional knowledge and will need to learn new tasks and skills. Benner also states these nurses may not revert to a novice level as they have transferable knowledge and skills. They have situational awareness and are uncomfortable because they know what they don't know and can see the bigger picture. However, they don't yet have the skills to tackle the issues. Benner's novice to expert theory does not expand on how to help those who do not progress from one stage to the next. Some nurses become stuck in a stage, and the theory does not describe how to guide them towards advancement. A clinical example is the nurse who functions well enough in daily practice, but still relies on others for guidance and direction. This may go unnoticed until they are placed in a situation where they are the most experienced person and others are relying on them for help. While some staff thrive and grow in these situations, others struggle as they lack the necessary skills or insight to advance their practice. It would be interesting to explore Benner's perceptions of reasons why some nurses do not achieve expert or proficient practice, and it would be helpful to see what strategies she would suggest.